Hi, and welcome to United Way of Miami-Dade's Health Tips. I'm Christina Brito, Senior Program Officer for Health, one of our 3 pillars at United Way. I'm also your host for today. We're having a discussion on COVID-19 antibody testing. Joining me today for our Health Tips is Dr. Daniel Caswan. He is an infectious disease specialist and serves as the Infectious Disease Fellowship Program Director at Aventura Hospital and Medical Center. Dr. Caswan, welcome to our Health Tips. It is a pleasure to have you with us today. I just want to say thank you for being with us.
Thank you very much for inviting me.
All right, so we'll go ahead and jump right into today's discussion. The first question is, there's been a lot of media coverage on COVID-19 testing, and many are confused as to what the options are that are available. Can you help clarify what is antibody testing and what are the different types?
Yeah, so antibody testing, antibodies are proteins that our defense system produce in the fight or in the help of fighting infections. So we detect them, and it's something that helps us see if somebody has been exposed. So you have early antibody response and late antibody response, and they're usually called immunoglobulins. And then so it's IgM is the early one, and the IgG is the late one. So then those are the ones that most of the time we hear when we start reading about it. So those are the ones that we test for, in this case, coronavirus, we have some, and then also for other infectious diseases that are out there like hepatitis, HIV. So we use it very frequently in the infectious disease world to try to see if somebody has had exposure to a specific infection.
Thank you for that. And should I get antibody testing?
First of all, I want to say it's not a test for really diagnosing. So if you think that you're having the infection or you're concerned and you want to do the testing, it has to be the swab testing, not the antibody testing. I know there's a lot of testings out there where they go in and they have sometimes they do like a finger stick and they put in a little cassette, and those will be antibody testing, but those are really not, the ones that we should be using to detect the infection and diagnose active infections. It's being used more to see if somebody may have been exposed or had the infection, and also being used if somebody already know that had it, if they develop the antibody in the process of, for example, plasma donation. So I think that people should be a little cautious about the testing that is out there. I think the message is, if you're going to donate plasma, they're going to do that test for you. Maybe if you want to have an idea whether you may have been exposed or not, you could ask your doctor for the test, but the interpretation is not 100% clear cut, and sometimes you can have false positive and false negative. So I think that the message is, it would probably best if it's for donation or if you're part of a study or the local health department or hospitals are asking you to do it as part of serology surveillance, we call it, and it's not for diagnosis if you really have symptoms and you want to know.
Okay. And if my antibody test came back positive, because you kind of touched on that right now, it means that I had it, not that I currently have it. Is that right?
So again, there's early antibodies and late antibodies. So if you have an early antibody, it could be that you're actually just having it, and you could be, at the early stages of that and just recovering from it. If you have the late antibodies, most of the time it means that you had it. Usually they take 2 weeks to detect the later ones, 2 to 3 weeks to detect the later ones. But again, there could be cross-reaction with other things. So you can have a positive test that is actually cross-reaction with other coronaviruses. And then, these tests also are interpreted in terms of like how many infected people are in the population. The more people that are infected in the population, the more reliable that a test that is positive will be truly positive and indicate that you had the infection. We think that's what we're going to be, at some point later on, where we are increasing numbers, that these tests are going to tell you that maybe you did not have symptoms too much, but you actually have the antibody. That means that you were exposed. I think that's where we're going to end up getting. But at this time, we're like in the middle of that.
Right. We're still in process, if you will. So, when it comes to, because you just mentioned early antibody testing and obviously the latter one. So if I test positive, am I still at risk in either having it or exposing somebody else?
Well, if you happen to get one of these tests and you get the IgM positive, yes, you're at risk, okay? But you should also, try to get then the swab test if you have not done it yet. If you test only IgG positive, then an IgM is negative, that means that probably you're not infectious again. But we are determining more the infectivity or not based on the swab testing and not the antibody testing. So the message is, if you test and there's an early test antibody, IgM, you should get the swab testing done.
Okay, that's good to know. As I mentioned, there's a lot of confusion as it relates to the testing and everything that's going on. I've seen on social media a lot of folks, and it's been on the news as well, people asking for plasma for their loved ones who are now coping with COVID. So should, assuming that I test positive, and I would say the latter of the two, should I donate plasma?
I think that you should reach out to the blood banks. I mean, there's organizations that are, taking care of that. I mean, the Red Cross and One Blood are, spearheading all these efforts. And I think they have a protocol in terms of what they will test. So if you have a positive antibody, you should reach out to them to see if they would do more workup, because then they would do their own specific antibody testing. They have a different type of testing that they go through to determine that you really have the right one and you really have it at the levels that you are actually able to donate the plasma. So I think you should contact the blood bank and they will ask what are the specific.
All right. Well, thank you, Dr. Caswan, and for being with us today and for sharing this great information. Again, there was a lot of confusion as it ties to antibody testing and what's the right ways. And I want to thank everyone for watching United Way of Miami-Dade's Health Tips. We hope these tips help you and your families and friends remain safe. And stay tuned for more information and health tips in the coming days.